this is Nancy Lindell in Public Relations with Mission Health, and I'm here today with Dr. William Hathaway, our Chief Medical Officer. We have sort of an update for our community and a little bit of what's going on with the numbers and what's going on with the vaccine and what kind of help we need from our community right now.
Yeah, I appreciate this opportunity. Of course, you know well that we've been giving updates throughout the course of the pandemic. It's been a few weeks since we've had a chance to record a video. And there have been some significant changes that have taken place since we last spoke. I think the first thing that is troubling to me, but not especially surprising, is that we're seeing a continued rise in both the number of cases locally and across the state, and we're seeing a concomitant increase in the number of hospitalizations at Mission.
And to what would you attribute that? I know that we're maybe even just this week going to be seeing the fallout from Thanksgiving, but our numbers have risen prior to that.
Yeah, we had noticed going into the Thanksgiving holiday that the cases were increasing across the state. We had been averaging between 30 and 40 patients hospitalized with COVID-19 illness pretty much through October and into November. And then we saw a gradual upward rise and a dramatic increase over the Thanksgiving holiday, which I think actually preceded a little bit the effects of how we behaved at Thanksgiving. And now we're hovering in the 70 or 80 range at Mission Hospital, and about 100 patients across our hospital system throughout Western North Carolina. I think in large part that's due to behaviors that took place at Thanksgiving. We know that the virus thrives on people being close together indoors and not masked. It's a droplet spread virus, and we know that droplets get spread when we're too close to each other. So there's no doubt that that's some of what we're seeing right now. And the cold weather drives people indoors where they're closer to one another.
So as a hospital system, we're still within our means to care for people. But I think what we want to point out is that that's an exponential rise in cases. We can't experience something where in 2 weeks' time we double the amount of patients that we're seeing.
That's exactly right. It's the rate of rise. It's the fact that it went up so quickly that troubles me. The absolute number's not so bad, but if we went from 40 to 80 in a 2-week period, we could easily go to 160 and more, which is what other health systems in the country that have really found themselves overwhelmed have experienced. And so this is, again, another warning, don't do that again. We need to be careful as we plan for the Christmas holiday that we don't repeat what we did at Thanksgiving, so that we protect ourselves, we protect our friends, we protect the vulnerable family members and others in the community that we have. And more importantly, we take some of this burden off the health system so that we can make sure we have adequate resources to treat everybody who needs our help.
Exactly. And that's all health systems. I mean, I know you speak regularly with those at Pardee and Advent Health and other places. And so we're just speaking on behalf of healthcare workers and health systems everywhere that we're in the fourth quarter of this game. And this past 2 weeks, we've taken a big sack, loss of yards.
That's exactly right. To use the football analogy.
That's right. That. And we need to all get up on the scrimmage line, 6 feet apart, masks on, clean hands, and see our way into the end zone. We're getting there. We're close.
That's exactly right. We are close, but the best defense we have right now is a prevent defense, where we prevent transmission of the disease by using masks and staying apart from one another. And that applies. I think the lesson learned from Thanksgiving, Dr. Fauci predicted it. We all predicted it here, that we would see a darker winter, and the winter is worse all across the state. I mean, the state saw a record number of cases and has had record highs over the last number of days. We've got to flatten that curve. We've got to go back to the blocking and tackling to flatten the curve and really get us where we need to be so that we're not overwhelmed by the disease.
Yeah, and I think, you and I, everybody can feel for the beleaguered weariness that we're all having about this social distancing, the masking, everything else. We're all tired, but we are in the home stretch, and we really do need people to cooperate and try and do their best to keep everybody safe.
Yeah, and specifically that means don't bring, I think the guidelines at the state level are 10 people or fewer in your house. But that doesn't mean go invite up to 10 people. And it means that when you're in your house, you try to stay outdoors or apart from one another, or you wear masks when you're together. I think the natural tendency to assume that the people we know and love are not infected or haven't done anything that they shouldn't have done. We have to avoid that. We have to assume that we're infected, each and every one of us, and that the people we come into contact with are infected. And even if we don't feel vulnerable ourselves to the illness, that we think somehow it's just an illness and we'll get through it, that's not the case. We are, each and every one of us, potentially vulnerable and can be hospitalized, and we know that our transmission can go to someone who can be hospitalized.
Exactly. And I think, if you do think of it as saying to yourself, I have this, and wear your mask and behave accordingly, then I think we can flatten that curve again. We were doing great, and we appreciate the help from the community.
It's time to get back on the game.
Yep.
I think the other exciting thing that's come along, and we certainly want to talk a lot about this today, is the vaccines.
Absolutely.
If we remember back in the spring of this year, we were optimistic that there may be a vaccine before the end of the year. That would have been a wildly optimistic approach back then. The pharmaceutical industry, the scientific academic community, and the government partnered across the globe to accelerate the process of vaccine development in a safe and effective fashion. And lo and behold, here we are, and we're expecting to get vaccine shipment this week. I think most people know that the vaccine that's produced by the Pfizer company in conjunction with a German company called BioNTech, BioNTech, has a vaccine that was approved for use by the FDA in an emergency use approval process this last week.
And the shipment that we'll be receiving towards the end of the week here at Mission Health, that's something that will be utilized across all of our hospitals, our 5 regional hospitals, Care Partners, and then Mission Hospital here in Asheville. Okay. And inclusive also, I want to mention, of our assisted living center in Highlands.
That's exactly right. So what the FDA and the Committee on Infection or Immunization Practices recommended is that we tier the community and the population as to who is the highest priority to need the vaccine. Because we know that although it's approved, we don't have immediate widespread availability of literally billions of doses to go around the world. And so the initial doses are being targeted for healthcare workers, especially those on the front line and likely to take care of COVID-infected patients. And then workers in skilled nursing facilities and their residents. And so that's what we're doing with our first wave of vaccine. The single most important reason why we're vaccinating the healthcare workers first is so that they can care for the rest of the community. I mean, there was a lot of debate about whether it should be healthcare workers or whether it should be those most likely to transmit the illness, but the decision was made that if we didn't shore up that safety net, that if we didn't absolutely ensure that those who were caring for the people who were sick with the vaccine, that we'd be in just a terrible amount of trouble. So that'll be very beneficial to get our workforce protected so that they can serve as the safety net to the community. And then people can feel comfortable and confident coming to the hospital that we've done all the barrier methods and the social distancing in the hospital to protect people. This will be an added layer of protection as people come to get their health services. We've received news from the state that with the Pfizer product, we think there will be about 85,000 doses distributed across the state this week. And we're getting some here as our other local health systems. And then we'll be administering that as soon as we can in a safe and effective fashion to our workers who want the vaccine. We anticipate that there will be an EUA, an emergency use authorization. The FDA will approve the Moderna vaccine. It's very similar to the Pfizer vaccine, and that should happen this weekend. And then we would anticipate an additional 175,000 doses, again going to health systems and health departments as of next week. So over 250,000 doses in the first 2 weeks to go out to healthcare workers and very, very high-risk individuals. And then last but not least, with respect to those numbers, the state is hopeful, again, there's a lot of uncertainty in all these numbers, but the state is hopeful that by the end of the year, 500 to 550,000 doses of vaccine will be available to the state of North Carolina. As we progress through the tiers, while we don't have definitive dates about when we'll move to the next tier, because it's so dependent on how many people want it and how much, it's that supply-demand equation, we will make sure that the public, through public health, through state resources, and through local health departments, we will let people know when the vaccine is available for them and how and where they can get it. We're still very much in the early phases of working all those operational and logistic aspects of mass vaccination out right now, but we'll make sure the public is well informed.
You have to have 2 of them. Am I correct about that?
Yeah, so it's an initial vaccination followed thereafter either 21 or 28 days later with a booster shot. The way the body handles vaccines or responses to vaccines is you get an initial recognition of this foreign protein, and then we produce antibodies towards that, and the body then, if it's challenged again, has an augmented response, an even better response where we produce more antibodies. And in both the Pfizer and the Moderna trials, they gave staggered doses and found really high effectiveness of the vaccine, 95% plus reduction in the number of people who were infected. Those people continued to wear masks and continued to practice social distancing. So that 95% effectiveness rate is in a setting where we continue to social distance, okay? So I don't want people to think that just because the vaccine's out there, that everyone then immediately becomes immune. We have talked a lot, and I'm sure people have heard about this concept of herd immunity. And the concept of herd immunity really comes from livestock management, where we know that if a certain amount of our cattle herd can be immunized against a disease, then the rest of the herd is protected. Well, that same concept applies to human. If we can get a certain percentage of the people immunized, or a certain percent of the people have developed their own immunity because they've already encountered the illness, then that's when we'll be able to start relieving ourselves of the masks and changing our behaviors a little bit. A lot of debate about what that number is. There are really, from an epidemiologic point of view, some pretty sophisticated ways to guess or measure what that number is. But most people believe it's at a minimum of 70% of the population has to either have had the illness or had gotten a vaccination before we're going to be really looking at changing how we behave with masks and social distancing.
So we need to continue at least probably through the spring and into the summer with our 3 Ws.
Yeah, and I think the one of the longest and most lasting effects of the pandemic, while we may cut back on the social restrictions, that is, have more openings of restaurants and higher capacity in the restaurants and movie theaters and all the other places, sporting events, while that undoubtedly will change over time, I think that many people will and should continue to be really attentive to masking when they're in crowded places, just to protect themselves from getting even the common cold. I think one of the reasons we've seen less influenza this year is because of the social practices that we've put into place. And as we're becoming more comfortable with the masks and using them in our daily lives, that's one of the long-lasting benefits that I think we'll continue to see. I can speak personally. I haven't had a cold all year long, and that's very atypical, given my job and where I work and the number of people I come into contact with. And I know that that's directly related to the fact that I've been attentive to wearing a mask in all circumstances.
Yep. The only thing it hasn't helped with is seasonal allergies.
Yeah, that's exactly right. We still haven't figured that one out.
Exactly.
And while we don't have a cure for the common cold, we certainly have a way to diminish the transmission by using barrier methods and distance methods.
Exactly. So in order to equate this to those watching with something that they're more familiar with, how would you equate it to the flu vaccine?
So it's very similar to the flu vaccine in the sense that it's administered in a similar fashion. A very small needle, a small amount of vaccine and diluent, which is the material that the vaccine is brought up in, injected. So less than a half a cc of fluid into the muscle. So that's where it's very similar. And then the body over 2 weeks or so develops a response. The difference between the flu vaccine and this vaccine is, number one, it's technically a different kind of a vaccine. It's an RNA vaccine, which is a nucleic acid vaccine, which is really exciting technology, and I encourage people who are interested to learn about that. There's lots of great information on the web about that. So it's a different kind of vaccine, and opposed to the flu vaccine, The SARS-CoV-2 vaccine requires 2 doses.
Okay, and with the flu vaccine, they try and make that based on the previous year's version of flu.
Yeah.
So that might be a difference with this one. Is so far there's just one version of what we're vaccinating against with the COVID vaccine.
That's right. The influenza virus, both A and B types, has this remarkable ability to mutate or change the way it looks. So that each and every year it can get a little bit more creative and reinfect people year after year. The SARS-CoV-2 virus doesn't have this mutation ability that we think of per se, and so we're hopeful that one vaccine will provide long-term immunity. To be completely honest, we don't know. We don't know if you're going to need a SARS-CoV-2 COVID-19 vaccine every year. We hope not, but only time will tell, and we're anxiously awaiting to see what happens over time.
And with the reaction to it, a lot of people tell me personally when they get the flu vaccine, it gave me the flu.
Yeah.
That really isn't possible.
It's impossible.
It's impossible.
Exactly. We don't use a live vaccine for the flu, and we certainly don't use it for SARS-CoV-2. That being said, it's not uncommon for people who develop an immune response. It's an inflammatory reaction to the vaccination. And so you can have local pain, injection site tenderness, redness, swelling. You can have aches and myalgias, and you can have more systemic symptoms. Myalgias are muscle aches. You can have more systemic symptoms, including a low-grade fever. About 10% of the people who were in the trials experienced this, and so we're watching very carefully as we administer this to hundreds of thousands and millions of people in these first few weeks, just to see what kind of reactions people experience.
And not to continue to draw the parallel, but in difference to the flu vaccine for our workers here at Mission Health, the COVID vaccine will not be required or mandatory.
Right. There's been a lot of discussion about whether we should require healthcare workers to get this vaccine. I think it's important to recognize that all available evidence points towards its, number one, its efficacy, meaning it works, and number two, its safety, meaning it has very, very few, if any, significant side effects. But this is not the normal process that the vaccine went through. So we have a lot to continue to watch and make sure it's effective and safe in the long run. And so right now, while we are encouraging everybody who's eligible in our facilities, we're not making it mandatory.
And to that end, I guess viewers may be wanting to know sort of ballpark when we get past these tiers of healthcare workers, et cetera, and when we might be vaccinating the public.
Yeah, I think so. So there are exactly, there are 4 tiers that we've come up with, 1A and 1B, 2, 3, and 4. And the farther down the range you go, the lower your risk is from suffering severe side effects from it, or severe sequelae from the infection itself. And so at the end of the line is the average Joe and John Q. Public, who doesn't have lots of comorbid illness. And then as you climb back up towards healthcare workers, in between we go for people who are higher risk, multiple comorbidities, multiple other illnesses, older people, frontline workers who are exposed and need to be out there on the front line and are at higher risk, and then those who have a more are better able to isolate themselves and protect themselves will be farther down the line. It is entirely dependent on how much vaccine is produced, how much vaccine, how many side effects, if we see any at all, which I don't think we'll see any, and then who is asking for this and how people uptake it. Right now, my guess is that we'll hit the 2nd, 3rd, and 4th tiers of people starting in late January, maybe February. We'll get into phase 2, and I would not anticipate that the average person who doesn't have an extenuating circumstance would be able to get vaccine until May would be a good bet. It could be later, it could be a little bit earlier, but it's going to be months and months before we're able to get the vaccine out in as widespread a fashion as we would like.
So that seems a good time for us to repeat that we are in the 4th quarter, and our message to our ask. We're really imploring our community to work with us here.
I can't emphasize enough how close we are to turning the corner. I haven't really felt this way until I had confidence that we were going to see the vaccine. That being said, we're not at the end of the game yet. We're going to be playing that. This is a long journey, and it's really important that people do their best to practice the 3 W's, to wear a mask, to wait 6 feet apart, to wash your hands and face. So please limit the size of your gatherings, behave in your homes and your friends' homes just as you would if you were out in public. Wear a mask, wait 6 feet apart, and wash your hands as frequently as you can, keeping them away from your mouth and your face. If we can all do this together, if we can just hold on for a little bit longer, I have no doubt that we will get through the holiday season into next year in a much better place.